Hi, I'm Matimba Swana. I'm a PhD student at the University of Bristol. I work with two supervisors, Professor Sabine Howard, who's a professor of swarm engineering, and Professor Jonathan Ives, who's a professor of empirical bioethics. I'm based in the School of Engineering, Mathematics and Technology and the Centre for Ethics in Medicine. My research combines cancer nanomedicine, swarm robotics, bioethics, and the use of virtual tumour models in clinical trials. My question is around the ethics and regulations needed for the first in human nanoswarm cancer clinical trial. Nanoswarm technology involves multiple nano-sized entities. Alone do nothing, but when activated, they can cooperate to perform a specific task. For example, find and target a tumour, make decisions about the state of a tumour, and optimize nanoparticle delivery. The Cancer Network Mini-MD allows PhD students and postdoctoral researchers conducting non-clinical cancer work, so for example, wet lab work, epidemiology, modelling, policy, to experience the cancer patient care and treatment pathway to gain a better understanding of how their research relates to clinical practice. I enjoyed the Mini-MD programme. I think the clinics and theatre were insightful. I shadowed breast and gynae, so it was good to see different aspects of clinical practice. I got to experience the full pathway for cancer, everything from multidisciplinary team sessions to clinics, chemo, surgery, and labs. It provided great insight into what the patient goes through and what the patient journey really looks like, as well as what the clinicians experience. I found it useful for my research. I think it allows you to make things more translational. For example, knowing how many drugs the patients have to take every day and how quality of life is a huge thing. Some of the patients that came into the clinic were on a cocktail of different drugs, so they could take one after food, another every 6 days, and another when you wake up. There was a lot. It means as researchers we can focus on making things that not only treat cancer but also help improve quality of life. The Mini-MD has helped me understand the complexities of patient care and inspired me to develop a use case for nanoswarm treatment. I'm now mapping out how this technology can not only treat cancer, but considering how it could also enhance patients' quality of life. The Mini-MD really helps bridge the gap between cutting-edge research and compassionate patient care.